Hello friends, I'm Jeanice Mitchell, pelvic health physical therapist, and today we are talking about pelvic floor muscle training and the common mistakes that we see. So how do you know if you're doing it right? Let's talk about it. Pelvic floor muscle training can be very simple. There are a lot of people out there that have different theories and thoughts and all of that, but I've basically consolidated a lot of information from various sources and research and textbooks and articles and my own personal experience, and I'm going to share with you the 10 most common mistakes that I see and what to do about it. Before we get started, this is a disclaimer. Remember that I am a physical therapist, but I am not your physical therapist. The information that I'm sharing is not medical advice for you and does not replace an evaluation by a qualified healthcare provider. This information is for awareness and informational, educational purposes only, but it's not medical advice for you. There are a few red flags that you need to keep in mind before you start any program, but specifically a pelvic floor muscle training program. Unexplained bleeding or pain, trauma, a fever or chills, night sweats, unexplained weight loss, unexplained weight gain, altered mental status, which is confusion, not being oriented to person, place, or time, and then depression or suicidal thoughts. If you have any of these, get checked out by your healthcare provider. So we're going to be going over two views of the pelvic floor. So in our Barbie, the first view that we're going to do is she's going to be cut in half down her center from the front to the back, and we'll be looking at the inside of her right internal organs. And so basically we'll see the pubic bone in the front and the tailbone, and then you would be looking at her internal organs that way. And then the second view is that we're going to look at her from below. So as if we were at the feet looking into the pelvis. And so first we'll look at with the skin on, and we'll name some of those structures. And then we're gonna take the layer of the skin off and get to see the muscles underneath. In this right side view of a female body, let's go over the anatomy. So you have the belly at the front and the buttocks at the back. Here's the pubic bone and the abdominal muscles. Here is the tailbone and the spine going up. This is your bladder, and this is where urine exits. It's called the urethral canal. Here's the uterus and the vaginal canal for sex and childbirth. And then here's the rectum and the anal canal where solid waste, liquid waste, and gas exits. And here is the clitoris. The pelvic floor muscles connect right there at the pubic bone and stretch all the way back to the tailbone. So it's kind of like a hammock at the base of your pelvis. Let's watch them contract. So as they contract, you can see they get bigger and stronger and they lift. They should go up and then they relax and the canals open and they kind of drop down. Let's watch that again. So watch that canal. It closes and the bladder lifts. And then when the pelvic floor muscles relax, that canal opens and the bladder drops a little bit. Same thing happens with the uterus and the rectal canal. Now, here we are looking into the pelvic floor as if we're at the feet, looking into the pelvic floor. Here's the knees, this is the inner thigh, this is the pubic bone and the tailbone, and here are all the beautiful pelvic floor muscles. You have multiple muscles that make up the pelvic floor, and they have different jobs, and you have different layers, and so it's more than just one little muscle. A lot of times I think people think, oh, it's a little Kegel muscle, let me just do a little squeeze, but there's multiple muscles that do multiple things. Okay, so here is another view from below with the skin on. So these are the buttock cheeks, this is the pubic bone and the pubic hair. Here is the urethral canal for urine to exit, the vaginal canal, and the rectal canal. And then this area is called the vulva. And here is the perineal body. So it goes from the vaginal opening there to the anus, that smooth area of skin. And this is an area that's frequently affected during childbirth. If you had an episiotomy or if you had a perineal tear, this is where that would occur. Now let's watch a pelvic floor muscle contraction from below. Again, here is the tailbone in the back, the pubic bone in the front, that's the clitoris, the urethral outlet, the vaginal canal there opening, and then the anus. All of these muscles are pelvic floor muscles. Let's pick one structure because there's a lot happening in this picture. So let's pick one structure. Let's start off with the anus, okay? And that's going to be the easiest place for you to start to when you're just starting off training. Where do you begin? I think the anus is a good starting spot, and there's research to show that as well. So you see how the anus, it tightens up and it kind of pulls up and in. So if you were to grab a mirror and pull down your pants and get in the bathtub or some other place, so if you were to grab a mirror and pull down your pants and get in the bathtub or some other place and check out your pelvic floor, it's not going to look like this, of course, because we have the layers of skin removed and you can see the muscles, underneath. And this is a schematic of the muscles. It's a little bit of an exaggeration for educational purposes. But basically, you grab that mirror, separate your butt cheeks, and you're looking at the anus. And when you squeeze, that anus should pucker up and in, and then you relax, and it relaxes and opens slightly. So let's watch that anus again. So you see how it closes and lifts, closes and lifts. And so that's what we're looking for when you squeeze. Now, the reverse should happen when you relax. So there's that anus again. That's a good landmark. And when you relax your pelvic floor muscles, the anus should kind of relax. It's not going to open like you see in it's not going to be brown. Well, hopefully it's not brown unless you're having stool coming out of your anus, which is a normal part of life. But as you're checking out your pelvic floor, hopefully you've timed the stool release so that it comes out when you're on the toilet. So basically it's going to be pink. It's for illustration purposes only that it's brown. And so when you squeeze and pucker up, it's going to be pink. It's going to look much more like this. It's going to be skin colored. Okay, so you see the contraction and the relaxation. Now let's just go over a little bit about what the pelvic floor does. Like what are the 4 phases of pelvic floor muscle training? So number 1, we need to correctly contract. And you saw a correct contraction, a couple different views of that. Then we need to completely let go. So we don't want to be clenched and tight all the time. Be active at the right times and relaxed at the right times. So what this means, let's just go back to the example of the anus. What if the anus is tight all the time? What would happen when you go to poop? Well, nothing would come out, or you'd have to strain and push really hard to overcome that muscle tone that's closing that canal. On the flip side, what if those muscles aren't very strong and they're kind of loose, they don't have very good tone, and you're jumping on a trampoline? Might you have some leakage of stool, whether it be liquid stool, solid stool, or maybe even leakage of gas? You might, right? And then the same thing applies to the other jobs and functions of the pelvic floor. Okay, so there's 4 jobs that we're going to discuss of the pelvic floor. Number 1 is support. So remember, here is our pelvis from below. Pelvis from the side. This is a female cut in half, pubic bone in the front, tailbone in the back, and you have the 3 pelvic organs: bladder, uterus, and rectum, and then the pelvic floor muscles stretch here. So remember, when they contract, they close those canals and they lift. So they have a supportive function. I like for people to think of an analogy of a bowl. So if you have a bowl, the outside of that bowl are your bones, and the bottom of the bowl are your pelvic floor muscles. So really, they literally are the floor of your pelvis. And on top of that floor, you have multiple organs sitting on the floor. So a bladder, maybe you still have a uterus and a rectum. And so these pelvic floor muscles are holding those organs up against gravity. If you could imagine that your bladder is like a water balloon, and as that balloon fills, the pelvic floor muscles are wrapping around that balloon outlet to keep it closed. And then when it's time to let go, then the pelvic floor muscles relax and urine exits. Now you can see that if the pelvic floor muscles weren't doing the right thing at the right time, you could either have leakage, or you could have difficulty emptying the bladder, or painful bladder syndrome, painful urination, and that kind of thing. The third function we'll discuss is sexual. So the pelvic floor muscles have a role during sex, and the wonderful thing is they automatically, rhythmically contract during orgasms for all genders. So that's pretty cool, right? To have your pelvic floor muscles activate during orgasm without even being consciously aware of it. But great, that's wonderful. So the pelvic floor muscles have this ability to squeeze, they provide tone, they provide sensation in the vaginal canal. On the flip side, the pelvic floor muscles also need to be coordinated enough to relax and to lengthen so that penetration isn't painful and so thrusting isn't painful. So if you could imagine that my hand here is the vaginal outlet, and if my vaginal outlet is closed like a fist, how difficult is it going to be to get something inside? Quite difficult, right? So we need the pelvic floor muscles to relax and lengthen so that penetration isn't painful. But it's a fine balance, because you also want them to be strong enough and have enough tone to provide sensation and pleasure during intercourse. So it's a balancing act. And then lastly here we have stability. The pelvic floor muscles are part of your core. And so if you think of your core as kind of like a canister, on top you have the diaphragm right there. And the diaphragm is a large muscle. It's like a pancake muscle. And then at the front, you have your deep belly muscles. At the back, you have your deep low back muscles. And then at the bottom, you have your pelvic floor muscles. And these four muscles work like a canister to help keep your spine, your pelvis, and your pelvic organs. So your core, or this canister, helps to keep your spine, pelvis, and pelvic organs strong, stable, and secure, and helps to control movement. All right, so now we have 10 common mistakes that happen with pelvic floor muscle training. So the first mistake is assuming that you're squeezing correctly, okay? So I know a lot of people are confident and they feel like they have a good connection with their bodies, but in some research, over half of people that were tested weren't squeezing correctly. So it's really, really, really important that before you start training that you know that you're squeezing correctly. I again think that one of the easiest ways is grabbing a mirror and checking out your anus. But if you're not sure, or you're having issues or questions or pain or difficulty, definitely connect with a pelvic floor physical therapist. And there are many options. If you don't live near one or you can't access one, there are many people that are doing virtual consults over telehealth. And so there's a lot of pretty cool options now that are happening. So number one, don't assume that you're squeezing correctly, verify. Number two, holding your breath. I'd say 99 out of 100 people that I teach hold their breath. It's a very, very rare person that doesn't initially hold their breath as they're starting to train. And so it's not the end of the world if you hold your breath, but understanding, okay, I'm holding my breath, I want to breathe. The pelvic floor works together with those core muscles to help do all of those jobs. And so to be most effective, we need to breathe and we need that air exchange. And also when you're holding your breath, you have the tendency to strain. So we're going to talk about that in a little bit. Not integrating strength and endurance training. So many people, again, believe that just a quick little Kegel squeeze is all that I need to do. Oh, I did my Kegels and they didn't work, or whatever. So we need to think about the muscles as skeletal muscles. So the pelvic floor muscles are skeletal, and that means that they can build strength. They can build hypertrophy, which means getting bigger. So if you were at the gym training your bicep and you wanted to get that bicep bigger, would you just do little baby squeezes? No, we're not going to. You're going to be building, you're going to be strengthening, you're going to be, we call it a maximum voluntary contraction. So we really want to give that a good, strong contraction, and then ultimately even building in and integrating some weight training can also happen with the pelvic floor. All right, and then the other part of that is endurance training. So not only do we want to have good, strong contractions to build strength, we also want to hold those contractions. So we're building endurance too. The pelvic floor has all these jobs that they need to do throughout our days. And if we're only training one little segment of its function, it's not going to do as well. Not integrating functional training. So this is a concept that is gradually evolving, but it's something that I've been working with my patients on since I first started becoming a pelvic therapist and really applying the principles that I learned at different courses and classes. How functional, because when we start with pelvic floor muscle training, usually we have a patient on a table and they're lying flat, right? They're lying flat like this. Well, how many times are we leaking when we're just lying flat? Or how many times are we having symptoms when we're just lying flat? The pelvic floor needs to work in functional, active positions. We want to move, and we need the pelvic floor to do its job throughout our day, whatever our jobs are doing, whatever our activities, we want the pelvic floor to integrate into that. So initially we work on isolating, and then we advance to functional training, only working on quick squeezes. So again, we need that endurance training to balance things out. Yes, we need them to quickly squeeze. So if you cough or sneeze or laugh or jump and it's a quick sudden movement, you need those type 2 fibers to quickly squeeze and to close off that outlet and to hold up those organs, right? Woo! We need that quick motion, but then we also need that endurance piece to hold your bottom up, to hold those organs up over time, because think about how much of your day you're spent in an upright position. So, you need that type 1, which is the marathoner fibers that we call them. We need both phases of the pelvic floor training and function. Not completely letting go. I believe that this is more common than people even realize, that we're either consciously trying to squeeze all day long to make our pelvic floor stronger, or we're subconsciously squeezing because we have stress or tension, and maybe that's just where we hold that tension in our pelvic floor. So intentionally squeezing but letting go, squeezing and letting go. And you may have heard this saying, Kegels are bad, throw Kegels out. Well, Kegels are fine. We need the pelvic floor muscles to squeeze, but we need them to let go just as much. And so if you're a person that is struggling with letting go, then no, we don't want you squeezing over and over. That's going to reinforce habits that we're trying to relax. But ultimately, in a healthy pelvic floor, we need it to be able to squeeze, and we need it to be able to completely let go. A nice analogy that I like to use is the hand. So if you are making a fist all day long, even if you held it, go ahead and make a really strong fist right now. And let's count to 10. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, squeeze. 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. And now open up your hand. It's stiff. You might have had reduced blood flow in there. And think about if you're doing that with your pelvic floor all day long, clenching. You can have decreased, like we said, blood flow. You can have shortening of the soft tissue. You can have shortening of the muscles. And that's the opposite of what we want. We need a healthy muscle that can squeeze, but also to let go. I'm going to create a video specifically on tips to let go and to train what we would call down training, but stay tuned for that. All right. Choosing the wrong starting position. Our pelvic floor is at the base of the pelvis, right? And so if you think about it kind of being a hammock here that's holding the organs up against gravity. So if you take that pelvis and you put it and you lie, like you lie in this position, you lie flat. Well, it's in a resting position there, right? It's no longer, gravity is no longer pressing down into that hammock. Gravity is now pressing here, and so the pelvic floor is more in a relaxed position. And then if you even took your hips and you put them up on a couple pillows or on a wedge, that actually tilts the pelvis kind of upside down almost, and it puts that hammock of muscles on definite slack. And that's one of my favorite positions for people that are having a difficult time initially contracting, because let's face it, this is a group of muscles that most people aren't connected with, and if they don't have dysfunction, for sure they're not thinking about their pelvic floor. And even if they do have dysfunction, if you have pelvic pain, or you're having urinary leakage, or you're having a vaginal bulge, or other symptoms, you may not even equate that your pelvic floor is causing it. So being able to connect with the pelvic floor is very important, and it's a lot easier, I think, to start off in a gravity assisted position, and then we would move to a gravity neutral position, and then generally I would move to sitting, and then I would move to standing, and then standing with a squat. And then in all of those positions you can do static training, which means you're still, or dynamic training, which means you're moving. So even if I had somebody that was on like on their back and they were up on a wedge, I can still have them doing some exercises with their knees or with their arms to work on that dynamic movement and control. Squeezing accessory muscles when trying to isolate. All right, here. So many people squeeze their butt muscles, their bottom, or they'll squeeze their outer thigh, or they'll squeeze their inner thigh. A lot of people also squeeze their belly. Some people clench their hands. Some people curl their toes. The point here is, it's not bad to squeeze those muscles, except that we're trying to train this group of muscles that has kind of been neglected. And probably you're trying to train these muscles because you may be having some kind of dysfunction. And so isolating and teaching the muscles to do the right thing at the right time and going through pelvic floor muscle training, we want to isolate first and then gradually work on integrating. Okay, pushing down instead of pulling up and in. And that can really cause problems. So if you think about this hammock, and if you're pressing down on that hammock over time, that can strain those pelvic floor muscles and even overstretch them. So we want to avoid that, really just avoid it. Okay, the next key mistake that we see is pushing down instead of pulling up and in. Remember, our pelvic floor muscles are this hammock at the base of the pelvis. And so this hammock is trying to counteract the forces of gravity and abdominal pressure and the pelvic organs. And if we are increasing that abdominal pressure and we're straining and pushing down on those pelvic floor muscles, that can cause them even further damage and can overstretch them. So we want to avoid straining. And that's one of the key things that you need to be looking for when you check out your pelvic floor muscles and look at your anus to see if you're squeezing. Are you pushing out? And if you're pushing out, then you need to stop and make sure that you go get some intervention and get connected with someone that can help you and make sure you're doing the right thing at the right time. Believing that it's for dysfunction only. So many of the times, people that aren't having dysfunction don't care about their pelvic floor muscles. Like, even when I'm talking to people, what? Pelvic floor muscles? Well, I'm not having any problems. I don't care about those, because that's kind of how we are. If something is functioning as it should, we're not really going to pay that careful of attention to it. Our heart, our lungs, or whatever, or our knee. For example, let's use the knee as an example. Are you going to think about your knee unless you start having pain in your knee, or your knee starts buckling when you go up the stairs or whatever? You're probably not. And so the same thing goes with the pelvic floor. Most people aren't going to think about their pelvic floor until they start to have some dysfunction. But it's a very important muscle group. And as you saw, it has many important jobs. And so I would encourage you to share the word and to spread pelvic health and hope and information with people that may not be having dysfunction now, and give them tips and tools to help them have a good, healthy pelvic floor. So who needs pelvic floor physical therapy? Here's some of the key categories: bladder problems, bowel problems, vaginal pressure or bulging, pelvic pain, or concerns with sexual function. Where can you find a pelvic floor physical therapist? On our website, mypfm.com, we have links to 4 free searchable databases, so check that out. Some of them are based more in the US and some are more global, but basically it's a great resource. And if you can't find someone, go ahead and direct message me or email me or connect with me on the website and just send me a message. And I'll do whatever I can to help connect you with a pelvic floor physical therapist. My goal is to give you help and hope and tools to help you live your best life. In closing, if you go to our website, mypfm.com, we have a downloadable handout called Pelvic Floor Muscle Training Tips, I believe. And so basically it has common mistakes and then it has the cues for them. And that's a really nice resource that you can download and use for your training. And then also if you work with other people or want to share it with other people, that would be fantastic. I'm going to include a link to that handout in the caption below here on YouTube. And I'd love to hear from you. Do you want to see videos on any of these other topics? I have 5 million ideas regularly churning in my head, and you can help guide where I devote my time and energy. So I want to say thank you. Thank you for joining me. Thank you for your support, and take care. Bye-bye.